My name is Stacey Pitts, and I am the co-founder of CBD BioCare. Joining me today is Dr. Frank Michalski. He is a chiropractor from Buffalo, New York, expert on using CBD, and he uses CBD BioCare in his practice and has done so for the past year and a half. Welcome.
Thank you for having me, Stacey. Happy to be here.
Today, we are going to focus on diabetes, and it's a disease that is extremely common in our country. If you have not watched our piece yet on inflammation, I would recommend that highly. And we're going to talk about diabetes and inflammation and how CBD can possibly help people fighting this disease. So let's first identify what is diabetes.
Of course, this is a great question. So let's start with giving people background. So diabetes, you have type 1 and type 2, and today we're going to be focusing on type 2, which usually develops over time due to a chronic inflammatory process that's been happening over the course of time, right? So most people don't just wake up one day and say, oops, I have type 2 diabetes. It's developed over a period of time. So let's talk a little bit about what diabetes is and how it develops. And I think once people listen to this explanation, it's going to make a lot of sense to them. So this is how we describe it to our patients. Every time you eat food, no matter what that food is, it converts to a molecule of glucose, okay? Glucose is sugar. Anyone suffering from diabetes knows they have to check their blood glucose levels, their blood sugar levels. So we eat certain foods, and let's say we're eating sugars or bagels or white breads, highly glycemic foods, right? Foods that are going to convert to sugar at a very rapid rate. So if I eat a piece of just plain white bread, that's going to turn into sugar in my blood very, very quickly. My blood sugar levels are going to go up. And this is really the hallmark trait of diabetes, one of them. Blood sugar levels start to rise. So when you go to a lab and you get your blood tester, or when you prick your finger, you're testing how much sugar is in your blood. So unhealthy foods, they spike blood sugar levels at a fast rate. Now, something happens. Imagine a bunch of little sugar particles floating around in your blood. Your brain recognizes this, and it tells your pancreas, an organ in your body, to release a hormone called insulin. This is another hallmark problem in diabetics, elevated insulin levels or no insulin in some cases. So your pancreas releases insulin. Insulin acts like a taxi cab driver, and it's going to drive all those little sugar particles to a cell in your body where they get used for energy. When someone is suffering from diabetes, that system has become broken. Those cells, they're full. They've had too much sugar. They're overloaded. The insulin receptors, the doors that open up on your cells to accept the sugar, have closed, and that's insulin resistance. So now we have a problem. That sugar is no longer going to the cells. We continue to eat these poor foods. Blood sugar levels keep going up. Your body keeps releasing more insulin. And the problem is this insulin has to take those sugars somewhere else. So it takes it and it stores it as fat, specifically as white fat, visceral fat that you can't see on the outside of your body. This is what surrounds the liver and the pancreas and the kidneys. It also takes those sugars and diverts them to other areas of our body. So it diverts it to our joints, our cartilage. It diverts it to the nerve endings where the sugars destroy the nerves. That's why you see blindness, numbness, tingling, retinopathies. That's why someone may injure their foot who's diabetic and not even know it because they've lost sensation. And then in a diabetic patient, often you see cardiovascular disease. These sugars damage the arterial walls of your blood vessels. Cholesterol then builds up in those walls. Eventually, that cholesterol becomes dislodged or that plaque, and we see a heart attack. So when we say, what is diabetes? It's elevated blood sugar levels, which essentially leads to a mass amount of inflammation affecting everywhere in the body, your brain, your eyes, your heart, your joints. And if we know someone who's severely diabetic, or if someone is suffering from this, I don't think they would disagree that each of those things are issues. But that's really the mechanism of what diabetes is and why it is as bad as it is.
Is it reversible if you have type 2 diabetes?
So it can be, and I think that's a debatable question. So I want to say maybe. So it really depends on the individual. We have unbelievable success at our offices when it comes to helping patients work with their physicians to get off of metformin, to get off of insulin. If people make that change and they decide, I'm going to get the correct help with nutrition, I'm going to look into supplementation that may benefit healthy blood sugar levels, that may benefit healthy cardiac values. Yes, I can tell you we have successfully had patients who were once diagnosed with diabetes and who no longer have diabetes. Not only that, and this is really good for your viewers, you will be denied life insurance if you go to apply and you have elevated cardiac markers and elevated blood sugar markers. You can reverse that. You can actually fix that. We've had numerous patients referred to us because they were denied for life insurance, and they've gone through the treatment plan and then gone and reapplied with these better lab values, and they've successfully obtained life insurance or disability insurance. So the answer is absolutely. I don't want to say it that's, I guess, totally proven in the medical literature, but we see it all the time here. We see it all the time. They had it once, now they no longer do.
That's awesome. So I know there's a number of things that contribute to that, including diet and working with a physician in terms of other possible medications or supplements that may help them. But one of the supplements, and the supplement of choice, of course, that we want to focus on is CBD. So let's talk about how a full spectrum CBD offered by CBD BioCare can assist a patient who is struggling with diabetes and diabetic symptoms.
Of course. So I think there's a few different avenues that we could discuss. And the most important one is probably helping with those blood sugar levels, right? Now, most of the trials that are more clinically oriented so far have been carried out in mice, okay? But they've seen some really neat things. So a lot of these findings that I'm going to explain have been seen in mice. Now, I can say from a just physician standpoint and working with patients, we see very similar results. But I just want to make it clear right now, obviously we're selling this may help support blood sugar levels, okay? But let me tell you what they found with mice. So when it comes to this, CBD has been shown to help stabilize, to help balance those blood sugar levels. So when you have a diabetic, they're usually going through these massive fluctuations of highs and lows. Blood sugar is up, now it's way down. It's back up, you take insulin, it skyrockets down. As your blood sugar levels are going up and down, so are your insulin levels. So one thing that happens is CBD helps to stabilize blood sugar levels, or may help to stabilize blood sugar levels. When we stabilize blood sugar, we stabilize insulin. When we stabilize our insulin, it has a very beneficial impact on other hormones, estrogen, testosterone, all those other things. So that's one way. The second way, and this is according to that government patent that we discussed in the previous podcast, where specifically they referred to it as a neuroprotective antioxidant. So this is really important because CBD is a neuroprotectant, it may help alleviate nerve pain caused from chronic inflammation. So imagine all those little sugar particles going around and creating something that we call AGEs. It's called AGE''S. These are advanced glycated end products, okay? These are literally the chemicals from inflammation that we see in diabetes that make us age. How do you beat these things? By taking an antioxidant. CBD has been shown to be just that. It prevents oxidation. So CBD is also being shown to be antispasmodic. In your gut, you have a lot of receptors for cannabinoids. A lot of people with diabetes suffer from GI spasms, or even just your day-to-day muscle spasms at night. I can't tell you the amount of diabetics patients that we work with the leg cramps in the evenings. CBD is shown to be an antispasmodic type supplement, okay? It may help with that. This one's very important because of the elevated risk of cardiovascular disease with the diabetic. The fact that CBD seems to have a vasodilating effect, it expands those arteries, allowing for more blood flow. This is great when it comes to helping promote a healthy blood pressure, or even helping promote healthy cholesterol levels. I can tell you I take good care of myself. I always had high hypertension, runs in the family. Couldn't do anything really about it for years. Even with good diet, we could get it down. I've been very fortunate in the time that I use CBD, that has stabilized quite nicely. I don't see the fluctuations. That was one of the many good experiences that I had with it. Now, again, do I exercise? Yes. Do I eat healthy? Yes. Is that a guaranteed result? No. Can I tell you from what I do, and I pay attention to the things I do, I believe that played a big role. And last thing too, anything that will help a diabetic with arterial inflammation, and CBD does just that. In our other podcast, we talked about inflammation in the arteries related to a protein called C-reactive protein, a protein that's released. Clinically right now, there's not research saying that it decreases C-reactive protein. I just don't think we've found that research yet. I'm not going to be surprised if in a few years that's one of the claims that's made about it. We know it does so much for inflammation. I'm sure we're going to see that in the future. And that's really, I suppose, the other big thing too, and this is important, especially for patients who are on insulin. When you do take CBD oil, it may lower levels of fasting insulin. What does that mean for the diabetic patient? They may wind up needing less insulin. And this is a beautiful thing. Diabetics struggle to lose weight, and I feel bad because it's not entirely what they're eating. They get told, oh, eat better, it's what you're eating. If they're pumping insulin all day long, and we're talking about a type 2 diabetic, it's almost impossible to lose weight because insulin's job is to store things as fat, specifically as something called white fat, visceral fat. So CBD oil works to help promote healthy insulin levels because clinically it has been shown to turn white fat into something called brown fat, which actually can help support healthy insulin levels. I'm sure in the future we're going to see that it probably helps to lower them. So I do say that as just an awareness for our diabetic patients on insulin. You really do want to be working with your doctor because there's a chance that you may need less. Of course, this isn't a free-for-all. One thing I hate to see is someone starts to take insulin or they take CBD or whatever it is, and they think, oh, I'm going to take CBD oil, but then I'm going to eat a cheesecake. It doesn't work that way, okay? So just something to keep in mind. But yeah, those are each of the advantages.
Okay, and just to be clear, we were really talking about the type 2 diabetic, but can the type 1 diabetic also benefit from CBD?
So the answer to that is yes. I will say that's something that I do not have a lot of experience with, and I kind of explain the basis of it though, or at least the working hypotheses. And the type 2 diabetic, or the type 1, and the type 1 diabetic, that's an autoimmune disease. So in autoimmune diseases, the body recognizes itself as dangerous, okay? So in rheumatoid arthritis, your own body's immune system attacks your own joints. And in type 1 diabetic, your body's immune system starts to attack the pancreas. And when that happens, your pancreas can no longer release insulin. And that's why type 1 diabetics have to be on insulin, because their pancreas has been destroyed. So they don't have that ability. The beautiful thing about CBD and potentially type 1 diabetics is it turns down that overactive immune system. So what they're starting to study is, okay, if we use CBD in a type 1 diabetic, can we get that person's immune system to stop damaging this individual's own pancreas? So that's one of the things we're looking at, or that you're starting to see. And I think another one is potentially going to be, hopefully these patients may one day need lower levels of synthetic insulin or insulin pumps. But really, it's to turn down that immune system, that autoimmune reaction in the type 1 diabetic.
Okay, and finally, what would you recommend? Where's a good starting point for somebody watching this that is a diabetic? What would you recommend in terms of serving size?
So, you'll hear me say this a lot, and really it sounds repetitive, but many disease processes are the same in how we approach it with CBD, at least for right now. So it's that standard serving size between 10 and 100 milligrams, and it's really going to vary patient or in clients, if you're talking to clients, or patients, in my case, patient to patient, because if that person's eating healthy, they're probably going to need a little bit less because that CBD is going to be all the more effective. If they're on insulin, they may need a little less, or we're going to approach it really cautiously. We're going to work up really slow. If they're on metformin, we're going to work up really slow. Because if we give them too much, and let's say it does have a very beneficial impact of stabilizing blood sugar levels and maybe dropping insulin levels a little, we don't want that person to pass out or to get dizzy. And this is super important, especially for our viewers who maybe just went and grabbed a CBD from the gas station and have really no concept of what they're doing. They really need to pay attention to that. Again, I say this all the time. This stuff does work. There's no doubt about that. But because it works, you want to be knowledgeable on it and just exercise some caution. So yes, we recommend a standard dose, 10 to 100 milligrams is where you want to start. Work your way up. I would say most patients that we deal with who have begun a healthy diet where they've really begun to make positive lifestyle changes, I would say they're right around 40 milligrams a day seems to be a nice number for them.
Okay, great. Well, thank you for your information and your knowledge about CBD. And I know this video is going to help people. So thank you very much for that.
Of course, anytime.